Cancer is a word that strikes fear into millions of hearts worldwide every year. It is not a single disease, but a complex collection of disorders characterized by the uncontrolled growth and spread of abnormal cells. These rogue cells can invade tissues, disrupt organ function, and, if untreated, lead to death. Despite its frightening reputation, the story of cancer is also one of hope, innovation, and remarkable medical progress. Understanding cancer, its types, how it behaves, and the treatments available is the first step in fighting it effectively. Each year, millions are diagnosed with cancer across the globe. The World Health Organization estimates that in 2022 alone, over 19 million new cancer cases were reported, and nearly 10 million people lost their lives to the disease. Among these, certain cancers stand out due to their prevalence, mortality, or the impact they have on patients' lives. Fortunately, medicine is advancing faster than ever, and treatments have evolved from blunt chemotherapy and radiation to precision therapies, immunotherapy, and innovative combinations that are saving lives every day. In this video, we will count down the top 4 most prevalent cancers in the world, diving into their biology, the latest treatments, breakthrough drugs, and innovations that are reshaping how doctors fight these diseases. Whether you are a patient, caregiver, or simply curious, by the end of this video, you will have a clear picture of how modern medicine is transforming cancer care. Some treatments sound like science fiction, yet they are very real, offering hope and improved outcomes to millions worldwide. Before we dive in, if you want to stay updated on the latest breakthroughs in drug treatments, cancer research, and innovative therapies, make sure to subscribe to Drug Insight Hub. Hit the notification bell so you never miss updates that could empower you or your loved ones in the fight against disease. With that, let's begin our journey through the world of cancer. Number 1. The most common cancer in the world: lung cancer. Lung cancer holds the top spot as the most common cancer in the world. It claims nearly 2.5 million new cases annually and causes over 1.8 million deaths, making it the leading cause of cancer-related mortality globally. The disease primarily affects the airways, bronchi, and alveoli, the tiny air sacs in the lungs. Its deadliness stems not only from its aggressive nature, but also from its stealth. Early-stage lung cancer is often asymptomatic, allowing tumors to grow unnoticed until they invade critical structures or spread to other organs. When symptoms such as persistent cough, chest pain, shortness of breath, or unexplained weight loss appear, the disease is often already advanced. Lung cancer is broadly classified into 2 major types: non-small cell lung cancer, NSCLC, which accounts for approximately 85% of cases, and small cell lung cancer, SCLC, which is more aggressive but less common. NSCLC itself is further divided into subtypes, including adenocarcinoma, squamous cell carcinoma, and large cell carcinoma, each with unique characteristics and treatment responses. What makes lung cancer particularly challenging is its molecular complexity. Every tumor can harbor a unique set of genetic mutations, and identifying these changes is critical for treatment planning. Key genes frequently altered include EGFR, ALK, ROS1, MET, KRAS, and BRAF, each of which can dictate a patient's response to targeted therapy. Furthermore, the level of PD-L1 expression on tumor cells guides the use of immunotherapy, as high PD-L1 levels can indicate greater responsiveness to checkpoint inhibitors. For early-stage lung cancer, surgery remains the cornerstone of treatment. Procedures such as lobectomy or segmentectomy remove the tumor and a portion of surrounding lung tissue, aiming to achieve complete resection while preserving respiratory function. In cases where surgery is not feasible due to tumor location or patient health, radiation therapy offers a precise, non-invasive option to eradicate cancer cells while sparing normal tissue. Often, chemotherapy is added to improve outcomes. Agents like cisplatin and carboplatin work by damaging the DNA of cancer cells, preventing replication and triggering apoptosis. However, the real revolution in lung cancer treatment comes from targeted therapies. Unlike conventional chemotherapy, these drugs are designed to attack specific genetic alterations driving tumor growth. Osimertinib, for example, is a third-generation EGFR inhibitor that binds irreversibly to mutated EGFR receptors, shutting down the signals that promote cancer growth. Remarkably, it can penetrate the blood-brain barrier, making it effective against brain metastases. For patients with ALK rearrangements, drugs like alectinib block the abnormal signaling that drives tumor proliferation. Those with ROS1 fusions may benefit from entrectinib or crizotinib, while MET exon 14 skipping mutations respond well to capmatinib or tepotinib, selectively inhibiting pathways that fuel tumor growth. Even more complex mutations, such as BRAF V600E, are treated with a combination of dabrafenib to block BRAF and trametinib to inhibit downstream MEK signaling. Immunotherapy has further transformed outcomes for patients with advanced lung cancer. Drugs like pembrolizumab and durvalumab function as checkpoint inhibitors, removing the brakes tumors place on the immune system. By reactivating T cells, these therapies allow the body's immune system to recognize and attack cancer cells more effectively. In patients with small cell lung cancer, historically one of the deadliest types, combinations of etoposide and platinum-based chemotherapy with immunotherapy have significantly improved survival rates. Recent advances also include combination therapies and antibody-drug conjugates, ADCs. Amivantamab, a bispecific antibody targeting both EGFR and MET, can be paired with lazertinib to overcome drug resistance by simultaneously inhibiting multiple pathways. ADCs, like datopotamab deruxtecan, act like guided missiles, delivering chemotherapy directly into cancer cells while sparing healthy tissues. These innovations represent the cutting edge of precision medicine, where treatment is tailored to a patient's tumor biology, maximizing efficacy and minimizing side effects. Despite progress, lung cancer remains challenging. The 5-year survival rate is still low due to late diagnoses. Early detection programs, including low-dose CT scans, liquid biopsies, and genetic profiling, are helping identify disease sooner, when curative treatment is possible. Artificial intelligence and machine learning are being deployed to predict drug resistance, optimize treatment sequencing, and personalize therapy for each patient. Today, lung cancer treatment is a complex interplay of surgery, radiation, chemotherapy, targeted therapy, immunotherapy, and ADCs, with treatment plans personalized based on tumor genetics, disease stage, and patient health. What was once treated with broad toxic interventions is now approached with precision and strategy, offering patients longer survival, improved quality of life, and renewed hope. As we close this chapter on lung cancer, we move to number 2, breast cancer, a disease that affects millions of women globally and exemplifies how modern oncology tailors treatment to tumor biology, combining surgery, hormonal therapy, targeted antibodies, and immunotherapy to improve survival and quality of life. Number 2, the second most prevalent cancer in the world, breast cancer. Coming in at number 2 on our list is breast cancer, a disease that affects millions of women and even some men around the globe. Each year, approximately 2.3 million new cases are diagnosed worldwide, making it the most common cancer among women, and it causes roughly 685,000 deaths annually. While early detection has improved outcomes dramatically, breast cancer remains a leading cause of cancer-related death, and its diversity makes treatment both challenging and fascinating. Breast cancer is not a single disease, but a collection of subtypes, defined primarily by the presence or absence of hormone receptors, estrogen receptor, ER, and progesterone receptor, PR, and the HER2 receptor, a protein that drives cell growth. This classification is critical because it determines the course of treatment. Tumors that are hormone receptor positive are usually more indolent, while HER2-positive tumors tend to grow faster but respond remarkably well to targeted therapies. Triple-negative breast cancer, TNBC, lacking ER, PR, and HER2 expression, is the most aggressive and historically the hardest to treat. For early-stage breast cancer, surgery remains the backbone of treatment. Depending on the tumor size and location, a patient may undergo lumpectomy, which removes only the tumor and a small margin of surrounding tissue, or mastectomy, which removes the entire breast. Surgery is often accompanied by radiation therapy, which targets residual microscopic cancer cells in the breast or chest wall, reducing the risk of recurrence. In addition, sentinel lymph node biopsy or axillary dissection helps determine whether cancer has spread to nearby lymph nodes, guiding the need for additional therapy. Systemic therapies, treatments that affect the whole body, are tailored to tumor biology. For hormone receptor-positive cancers, endocrine therapy is the mainstay. Drugs like tamoxifen, which blocks estrogen receptors, or aromatase inhibitors such as anastrozole, letrozole, or exemestane, which reduce estrogen production in postmenopausal women, are highly effective in slowing tumor growth. Combining endocrine therapy with CDK4/6 inhibitors like palbociclib, ribociclib, or abemaciclib further disrupts cancer cell division, producing longer-lasting responses. Recent studies show that adding a CDK4/6 inhibitor can nearly double progression-free survival in advanced hormone receptor-positive breast cancer. HER2-positive breast cancers have undergone a treatment revolution over the past 2 decades. Trastuzumab, the first HER2-targeted monoclonal antibody, binds to the HER2 receptor, blocking growth signals and recruiting immune cells to attack the tumor. Pertuzumab, another HER2-targeted antibody, works synergistically with trastuzumab by binding a different part of the receptor, preventing dimerization and signal amplification. In combination with chemotherapy, these therapies have significantly improved survival, with 5-year overall survival rates now exceeding 90% in early-stage disease. For patients whose disease progresses despite these antibodies, T-DM1, adotrastuzumab emtansine, an antibody-drug conjugate, ADC, delivers a cytotoxic payload directly to HER2-expressing cancer cells, minimizing damage to healthy tissue. The newest ADC, trastuzumab deruxtecan, Enhertu, has shown remarkable results in both HER2-positive and HER2-low tumors, combining precise targeting with a potent chemotherapy derivative to attack even resistant disease. Triple-negative breast cancer, while historically the most difficult to treat, has seen exciting advances. Standard chemotherapy remains central, often including drugs such as anthracyclines, doxorubicin, taxanes, paclitaxel, docetaxel, and platinum compounds, carboplatin. However, the addition of immunotherapy is changing the outlook for patients with PD-L1-positive tumors. Atezolizumab, a PD-L1 inhibitor, in combination with chemotherapy, activates the immune system to recognize and attack cancer cells, producing durable responses that were previously unattainable. Emerging treatments for TNBC also include PARP inhibitors such as olaparib or talazoparib for patients with BRCA1/2 mutations, exploiting the tumor's defective DNA repair machinery to induce cancer cell death. Beyond standard treatments, personalized medicine is reshaping breast cancer care. Comprehensive genomic profiling can identify rare mutations and vulnerabilities, allowing oncologists to tailor therapy with unprecedented precision. Clinical trials are testing novel combinations of immunotherapy, targeted therapy, and ADCs to further improve outcomes. For example, combining checkpoint inhibitors with HER2-directed therapies is being explored to harness the immune system against previously resistant disease. Survivorship and quality of life are also central to breast cancer management. Therapies are now designed not only to extend survival but also to minimize long-term side effects. For instance, Newer HER2 targeted ADCs reduce the cardiac toxicity previously associated with trastuzumab, and oral agents like CDK4/6 inhibitors allow patients to maintain daily routines without frequent hospital visits. Lifestyle interventions, including exercise, weight management, and nutrition, have been shown to reduce recurrence risk and improve overall well-being for survivors. The impact of these innovations is visible in the statistics. In high-income countries, 5-year survival rates for breast cancer now exceed 90%, largely due to early detection, effective surgery, and targeted systemic therapy. However, global disparities remain. In low- and middle-income countries, delayed diagnosis and limited access to advanced therapies contribute to higher mortality, highlighting the need for worldwide access to screening and modern treatments. Breast cancer exemplifies how modern oncology combines biology, technology, and patient-centered care. Surgery removes tumors, radiation consolidates local control, endocrine therapy and HER2-targeted therapies block growth signals. Immunotherapy and ADCs attack cancer cells more precisely, and genomic insights tailor treatment to each patient's disease. The result is a multifaceted, personalized strategy that improves survival, reduces toxicity, and offers hope to millions. As we close our discussion of breast cancer, it is clear that the disease's complexity has driven medical innovation, producing therapies that were unimaginable just decades ago. From targeted antibodies to immunotherapy and PARP inhibitors, breast cancer treatment demonstrates the power of precision medicine. And now, we move on to number 3, colorectal cancer, where molecular profiling and immunotherapy are transforming what was once a uniform chemotherapy approach into a highly personalized treatment strategy. Number 3, the third most prevalent cancer in the world, colorectal cancer. Number 3 on our list is colorectal cancer, a disease that arises from the lining of the colon or rectum. Globally, colorectal cancer affects over 1.9 million people each year, making it the second leading cause of cancer-related death, with approximately 935,000 deaths annually. The risk of developing colorectal cancer increases with age, but lifestyle factors such as diet, obesity, smoking, and physical inactivity also play significant roles. Beyond these, genetic predispositions, including mutations in APC, MLH1, MSH2, and other DNA repair genes, can dramatically increase the lifetime risk, highlighting the importance of both prevention and early detection. What makes colorectal cancer particularly interesting and challenging is its molecular diversity. Each tumor can carry a unique set of mutations that drives its growth and determines how it responds to therapy. KRAS, NRAS, and BRAF mutations, along with microsatellite instability, MSI, and mismatch repair deficiency, DMMR, are key molecular fingerprints. These characteristics not only indicate prognosis, but also guide treatment decisions, ushering in the era of precision oncology. For patients diagnosed at an early stage, surgery is the mainstay of treatment. A colectomy, either partial or total depending on tumor location, removes the affected section of the colon or rectum along with regional lymph nodes. The goal is curative, and when successful, surgery alone can lead to long-term survival. However, adjuvant chemotherapy is often recommended, especially for stage 3 cancers or high-risk stage 2 tumors, to eliminate any microscopic disease that may remain. Standard chemotherapy regimens include FOLFOX, combining folinic acid, fluorouracil, and oxaliplatin, and FOLFIRI, which substitutes irinotecan for oxaliplatin. These drugs work by interfering with DNA replication and cell division, effectively killing rapidly dividing cancer cells. For some patients, biologic therapies are added to chemotherapy. Bevacizumab, a monoclonal antibody targeting VEGF, prevents the formation of new blood vessels that tumors need to grow. Meanwhile, cetuximab and panitumumab target the EGFR receptor, but only work in patients whose tumors are wild-type for KRAS and NRS. Mutations in these genes render EGFR-targeted therapy ineffective. The integration of these biologics has improved response rates, progression-free survival, and overall survival in metastatic colorectal cancer, though careful molecular testing is essential to avoid ineffective treatment. Rectal cancer, a subset of colorectal cancer, often requires a multimodal approach. For locally advanced disease, chemoradiation is frequently given before surgery to shrink the tumor, making it more operable and reducing the likelihood of recurrence. This strategy sometimes allows for sphincter-sparing surgery, preserving bowel function and significantly improving quality of life. Post-operative chemotherapy may follow, especially in high-risk cases, further enhancing outcomes. For advanced or metastatic colorectal cancer, precision medicine has dramatically changed the treatment landscape. Tumors with MSI high or dMMR status are particularly responsive to immunotherapy. Drugs like nivolumab and pembrolizumab, which are PD-1 inhibitors, release the brakes on the immune system, allowing T cells to recognize and attack cancer cells more effectively. In combination with CTLA-4 inhibitors such as ipilimumab, these therapies can produce deep and durable responses, sometimes achieving complete remission in patients whose disease would previously have been considered untreatable. For tumors with specific mutations, targeted therapies offer remarkable benefits. Patients with BRAF V600E mutations may receive encorafenib, a BRAF inhibitor, combined with cetuximab, shutting down the cancer-driving signaling pathway and slowing tumor progression. This combination represents a precision strategy tailored to the tumor's molecular vulnerabilities. Similarly, HER2 amplification, present in a minority of colorectal cancers, can be targeted with combinations of trastuzumab and pertuzumab, demonstrating that insights from breast cancer therapy can also benefit colorectal cancer patients. Beyond drug therapy, ongoing research is exploring the sequencing and combination of treatments to maximize efficacy. Studies are investigating whether immunotherapy could be moved earlier in the treatment timeline, even as neoadjuvant therapy for locally advanced rectal cancer. Early results suggest that some patients achieve complete pathological response with checkpoint inhibitors alone, raising the possibility of avoiding surgery altogether in select cases, a truly revolutionary approach. Prevention and screening remain critical in colorectal cancer. Colonoscopy, fecal immunochemical testing, and stool DNA tests have dramatically reduced incidence and mortality in populations with regular access to screening. Lifestyle interventions such as high-fiber diets, physical activity, and limited alcohol consumption can also lower risk. However, disparities in access to screening contribute to higher mortality in low- and middle-income countries, underscoring the importance of global health initiatives. The evolution of colorectal cancer treatment exemplifies the power of combining traditional therapies with modern precision medicine. Surgery removes tumors. Chemotherapy attacks rapidly dividing cells. Biologics block growth signals or blood vessel formation. Immunotherapy reinvigorates the immune system, and targeted therapies shut down mutation-driven pathways. This comprehensive, personalized approach has improved survival rates significantly. In high-income countries, the 5-year survival rate for localized colorectal cancer exceeds 90%, while metastatic disease, once almost uniformly fatal, now sees meaningful responses in patients with carefully selected therapies. Colorectal cancer teaches us an important lesson. Understanding the tumor's biology at a molecular level is essential. By exploiting specific vulnerabilities, oncologists can craft treatment plans that are both more effective and less toxic than the old one-size-fits-all chemotherapy approach. The future promises even more sophisticated strategies, including novel immunotherapy combinations, ADCs, and precision-targeted drugs, all aimed at turning colorectal cancer into a manageable and sometimes curable disease.
As we finish our deep dive into colorectal cancer, it's clear that each patient's journey is unique, and treatment is no longer about just survival. It's about maximizing quality of life, minimizing toxicity, and tailoring therapy to the tumor's genetic fingerprint. And now, from the colon and rectum, we turn our attention to number 4, prostate cancer, a disease that challenges physicians to balance effective therapy with quality of life considerations, especially as many men face tumors that range from indolent to aggressively lethal.
Number 4, the fourth most prevalent cancer in the world, prostate cancer. Number 4. On our list is prostate cancer, a disease that primarily affects men arising from the prostate gland, which produces seminal fluid. Globally, prostate cancer accounts for over 1.4 million new cases annually and causes around 375,000 deaths each year, making it one of the most common and impactful cancers among men. The risk of developing prostate cancer increases with age, particularly after 50, and is higher in men with a family history of the disease or certain genetic mutations, such as BRCA1, BRCA2, and HOXB13. Lifestyle factors, including diet, obesity, and physical inactivity, also play roles in disease incidence, but the biological and genetic underpinnings often dominate the disease course. What makes prostate cancer particularly intriguing is its wide spectrum of behavior. Some tumors are indolent, growing so slowly that they may never threaten a man's life, while others are aggressive and can spread rapidly to bones, lymph nodes, and other organs. This variability has fundamentally shaped modern management strategies, where the emphasis is on balancing effective tumor control with preservation of quality of life. For men diagnosed with low-risk, localized prostate cancer, active surveillance has become a standard approach. Instead of immediately undergoing surgery or radiation, patients are carefully monitored with regular PSA testing, imaging, and periodic biopsies. This approach avoids unnecessary treatment-related side effects such as urinary incontinence and erectile dysfunction, which can significantly impact quality of life. If the tumor shows signs of progression, intervention can be initiated promptly, ensuring safety while minimizing overtreatment. When the disease is higher risk or locally advanced, treatment becomes more aggressive. Radical prostatectomy, the surgical removal of the prostate gland, is often performed, sometimes accompanied by lymph node dissection to assess potential spread. Modern surgical techniques, including robot-assisted laparoscopic prostatectomy, allow for precision removal of the tumor while minimizing blood loss and recovery time. Radiotherapy, using external beam or brachytherapy, is another mainstay, often combined with androgen deprivation therapy, ADT. ADT reduces levels of testosterone, the hormone that fuels most prostate cancers, effectively starving the tumor and slowing its growth. For patients with advanced or metastatic disease, treatment becomes more complex and highly individualized. Standard ADT alone is frequently insufficient, so newer androgen receptor-targeted therapies are employed. Enzalutamide, for instance, binds directly to androgen receptors on prostate cancer cells, blocking testosterone from activating them, while apalutamide and darolutamide act similarly, preventing receptor activation and nuclear translocation. Abiraterone, another breakthrough, works differently by inhibiting the enzyme CP17, which is critical for androgen synthesis, thereby reducing testosterone production from both the testes and adrenal glands. These drugs have dramatically improved progression-free survival and overall survival in men with metastatic castration-resistant prostate cancer, mCRPC. Chemotherapy still has a role, especially for aggressive or rapidly progressing tumors. Docetaxel, combined with prednisone, interferes with microtubule function, inhibiting cell division and promoting apoptosis in rapidly dividing cancer cells. Cabazitaxel is used for patients whose disease progresses after docetaxel, providing a valuable second-line option. These chemotherapies, while effective, are typically reserved for advanced disease due to potential side effects like neutropenia and neuropathy. One of the most exciting innovations in prostate cancer therapy is radioligand therapy, specifically Pluvicto, IR, lutetium-177, PSMA-617. This therapy acts like a guided missile for cancer cells. It uses a molecule that binds specifically to PSMA, prostate-specific membrane antigen, a protein highly expressed on prostate cancer cells, and delivers beta radiation directly to the tumor while sparing normal tissues. PSMA PET imaging is used to select patients whose tumors express PSMA, ensuring maximum efficacy and minimal toxicity. Clinical trials have shown that Pluvicto can significantly reduce tumor burden and delay disease progression, offering a non-chemotherapy systemic option for men with mCRPC. For men with DNA repair gene mutations, including BRCA1, BRCA2, and ATM, PARP inhibitors provide another precision therapy. Drugs such as olaparib and rucaparib exploit defective DNA repair pathways in tumor cells, causing accumulation of lethal DNA damage while sparing normal cells. These agents have transformed outcomes for a subset of patients who previously had limited options, exemplifying how genetic testing is now a critical component of prostate cancer management. Beyond these systemic therapies, bone-targeting agents are crucial in managing prostate cancer due to the high risk of bone metastases. Radium-223, an alpha-emitting radiopharmaceutical, selectively targets bone metastases, delivering localized radiation that kills cancer cells while minimizing damage to surrounding tissue. Denosumab and zoledronic acid are also used to strengthen bones and reduce the risk of fractures in patients with metastatic disease. Prostate cancer treatment today represents a sophisticated balancing act. Early-stage disease emphasizes surveillance and minimally invasive intervention to maintain quality of life, while advanced disease leverages a growing arsenal of hormonal therapies, chemotherapy, radioligands, PARP inhibitors, and bone-targeted agents. The goal is clear: extend survival, minimize toxicity, and tailor therapy to each patient's unique tumor biology. Screening remains a critical aspect of prostate cancer care. PSA testing has enabled earlier detection, which has contributed to a decline in prostate cancer mortality in high-income countries. However, screening strategies must be personalized, as PSA can also detect indolent tumors that may never cause harm, and overdiagnosis can lead to unnecessary treatment. In summary, prostate cancer illustrates the evolution of oncology from generalized treatment to precision medicine. By understanding the tumor's molecular and hormonal drivers, clinicians can select therapies that directly target the cancer while preserving normal function and quality of life. The combination of surgical advances, radiation technology, hormone therapies, immunotherapies, radioligand therapy, and genetic-driven precision medicines has transformed the outlook for men facing this disease. With ongoing research, the future holds the promise of even more effective, less toxic, and more individualized treatments, ensuring that prostate cancer is not only treatable, but manageable over the long term. As we conclude our detailed exploration of prostate cancer, it's evident that modern therapy is about more than just survival. It's about empowering patients to live better, longer, and with dignity. Subscribe to Drug Insight Hub for clear, practical insights on the world of medicine.